what should you expect after surgery? First of all, you'll be given some prescription medications, which include a week of oral antibiotics. Tylenol and Advil are usually sufficient for pain control. However, I will give you a little extra pain control for breakthrough pain. If you are receiving a tympanoplasty and mastoidectomy, you will also be given some Ciprodex drops to start 2 weeks after surgery, and you will continue those drops until I say it's time to stop. You will also might be given some bacitracin ointment if I take a little skin graft behind the ear. It's normal to hear some crackling and popping after the surgery just due to the packing that is in the middle ear space as well as the ear canal. You will also have this dressing, and this dressing will stay on for 24 hours unless I say to stay on longer. It will have many different parts. First of all, you will have skin glue that is purple over the incision, and that is to stay dry. So after 24 hours or 48 hours, you will then take a pair of scissors and cut right up the front of the dressing, just like this. Then everything that's white peels off. So you come around here and you will have several different white parts. First of all, it's normal to have some blood on the dressing. That's nothing to be alarmed about. You will have some gauze. You will have a cotton ball, which you can remove. However, there's packing underneath the cotton ball filling the canal. Do not remove the packing. You will then have some gauze behind the ear and this white non-stick layer that all comes off. The packing look like this. They are tiny little gel foam pieces that then will absorb the blood and turn red. Don't be alarmed if some of those pieces come off on the cotton ball. If I needed to take a skin graft during your surgery, you will have a second dressing. This stays on for 1 week and you are not to remove it. I will remove it in the clinic, and then you will start placing bacitracin ointment on the skin graft site after a week. So I will remove this, but again, this stays on. You keep it on and you keep everything dry. So there's a clear plastic piece, and then there is a yellow gauze over your skin graft site. So keep that on and I will take that off in clinic. The other instructions, so for the first week, you are to keep everything dry from water. Just take a towel, fold, 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 hold it over the entire surgical site, and you can go ahead and wash your hair with assistance in the shower. And then after a week, I'll give you clearance to get the back of the incision wet. I don't want you to do any heavy lifting, do an open mouth sneeze, do not pinch your nostrils together, and do not violently blow your nose. You can do walking and stationary bike to get your heart rate up, but no heavy exercise or straining for about 3 weeks or so. You can also fly after a week, and we will discuss work when you can go back to work based on what your job entails. If you're doing desk work, usually just a couple of days after general anesthesia wears off. But if you do more physical work, we will discuss that in clinic. An additional instruction for all post-auricular incisions, meaning any incisions behind the ear, you will have the skin glue that's purple. And also, I don't want anything rubbing on that incision for 1 week. So I'll either ask you to wear the glasses on the outside of your ear for a week, or take off the wing of the glass so that nothing is rubbing on the incision so it can heal for 1 week. I also ask that you don't wear any masks that loop over the ear to pull the ear forward. We want the ear to heal flat. So if you need to wear a mask, I ask you to wear the kind that tie in the back and nothing over the ear to pull the ear forward.